Closed captioning provided by... It's a big show today, all about your private parts, and we've discussed the distinct male and female parts. Now we're down to the butt, and we have someone new joining us. We have Dr. Cherlin Johnson, who is also an emergency medicine specialist from Beverly Hills, California here. Welcome,
yes,
Dr. Johnson.
Thank you so much. Thank you so much for having me.
And we're starting off with a question from Nancy from Antioch, California, waiting on the line with a question. So, Nancy, what's your question?
Hi, doctors. I have a question about anal sex. Is it safe to have anal sex and vaginal sex afterwards?
Okay, well, Nancy, so the answer to this question is no. So as you can imagine, the rectal area, the anal area has a lot of bacteria, and the last thing you want to do is move that all into the vaginal vault. That's going to lead to possible vaginal infections, as I'm sure Dr. Lisa will tell you.
That's a no-no.
That's a no-no. So anal to vaginal is a no-no.
Yeah.
And I think an important point to talk to folks about is people who are having anal sex regularly testing in that area, right?
Okay, I'm so glad you brought that up. This is a big deal now. I think a lot of people are starting to become more aware of anal cancer, and screening for anal cancer is a big deal. So I think we've all heard a lot in the news about HPV, right? Mm-hmm. And HPV with respect to cervical cancer and pap smears and all of that. Well, now we're actually doing what we call the anal pap smear. You're basically, it's a simple procedure. I brought a brush. This is the brush, and it's inserted into the anal area. You circle it around, and you take the cells, and you send it off to the lab, and you look for any sort of abnormal cells, and this is very important. I think the tricky thing is, who should we do this on, right? There's not a lot of guidelines. This is a newer test. They definitely recommend any homosexual men, HIV-positive individuals having anal sex should definitely get the test done. If you are a woman and you're having anal sex, you should talk to your doctor about screening. The frequency is really going to depend on you. It's how many partners you have and how frequently you're having anal sex.
You're not going to get pregnant, obviously, having anal sex, but the chances of getting STDs is higher with anal sex. So protected sex is even, well, it's always important.
Always important, but it's just as important.
Critical with anal sex.
If you engage in anal sex, you've got to get tested. But Nancy, thanks for asking that question.
Yes.
But we're not done yet. We've discussed the major private parts, but what about the parts of the body people just don't like to talk about? Well, up next, how to get rid of unsightly armpit fat. Stay tuned. We've answered your questions about most of your private parts, but there are a couple of more that we want to tackle, like the armpit. And Christian had a question regarding her armpit that she wanted to ask us.
Hi, doctors. I have this armpit fat that I don't like. I want to know, how do I get rid of it, and where does it come from?
The old armpit fat dread. And Christian, is that a problem you've been experiencing for quite some time?
Just the pudge. Yes.
Just the pudge?
Yeah. Just how do I get rid of it? Exercise?
Well,
where does it come from?
I think the hard thing in terms of getting rid of it, it's hard to just spot lose. I mean, it's hard to say I want to lose fat right here. So losing weight everywhere can decrease it, but if you don't need to lose weight everywhere, you're probably looking more at doing a spot treatment like a liposuction.
What happens, you know, as we age, there's, for some reason, the body puts extra fat there, but it's also a question of loose skin, that just from moving your arms, you know, throughout the course of your life, it leads to some laxity, some loose skin that you get everywhere in your body in parts where you're moving joints all the time. So it's a combination of loose skin and fat. In some cases, just doing a little spot liposuction through a tiny incision. I'd make an incision right here in the armpit like so. I don't know if you can see that, right in there. And with my trusty liposuction instrument, actually go in there and tunnel out, remove that fat permanently, put you in compression, which is going to help this skin smooth out and take care of that excess bulge. If it's a question of excess skin, then in a case like that, you may actually have to remove a little section of skin right here and actually do a lift that we hide that incision in the armpit.
And also without paying him all the beaucoup bucks. You can take away that.
Lisa, come on.
Sorry. You can take away that pudge with, or just armpit fat. I don't know about pudge. I don't know if I like that name. But with a really good bra. 75% of women don't wear an adequate size bra, and so that causes things to spill out. And you'd be surprised what, things you can correct with just the right fitting bra.
So thanks for the question.
Thank you.
Dr. Johnson, thank you as well.
Yes, thank you so much for having me.
We appreciate you being here today. Up next, we have one more tip to share. It has to do with a private body part that may finally be the cure to holding it in.